Hello, my name's Leonie Sinclair, and I am doing the interview with Suzi, who has bipolar.
And I'm playing Suzi. I'm Caitlin Sinclair, and I'll be, help you out.
Are you happy to do the video, Caitlin?
Yes.
Thank you. Hi, Suzi. Thanks for coming in today.
No worries.
What have you got going on?
So basically, I have a very stressful lifestyle at home. I have my parents I have to look after. I have 5 kids who are, the youngest one is 2 and the oldest one is like 17. And my husband he was working, but then he's not working anymore, and he just lost his job, and it's very, very stressful. I'm very, worried about money and how we're going to get through it all, and it's all falling on me to look after everyone, it feels like. And it's hard to cope.
What have you been doing to try and get through this stressful time? It sounds very stressful.
Yeah.
You've got a lot on your plate.
Yeah, so in the past I've had bipolar disorder, which is, I'm sure you know all about that. And that was kind of a lot of pressure on everyone, hard to deal with, made it just like even more difficult. And but I've been off medication now for really 4 years, I think. So that's alright. But coping with a bit of depression and things like that still lingering. So I think I probably have my little faults that I use to cope, and like everyone does. So yeah.
Sounds like it's been a really tough period for you and the family.
Yeah.
You've got a lot on your plate. You're trying to get through it as best you can. Your husband's just lost his job. That must be really quite a stressful period.
It's like another thing on top of everything else.
Yeah, and looking after your parents as well. That must be quite difficult. And you mentioned that there's you have your little things that you're trying to...
Yes, my happy drinks.
Right, yeah, your happy drinks.
I probably drink too much, some people might say. But it's just like a coping mechanism, I feel like. It's just, there's so much going on. I just have to have some outlet. Otherwise I'll just,
When you're drinking, when's that occurring? Are you what's the frequency like for that?
Well, my husband usually brings something home just to to wind down, his way of winding down. And so I usually drink with him at dinner. Then it kind of continues into the night. I probably go through a bottle or sometimes 2. Especially on the weekends with when it's just the kids aren't at school. It's just extra pressure.
So would you say that you're drinking more on the weekends than during the week?
I think so, yeah, definitely. It's just the house is just so loud and a big mess, and so it's
and
to distract me.
And how long have you been drinking for? How long has that? The heavier drinking, where you've been drinking up to 1 or 2 a night.
It was probably so. I've been off medication because I didn't really the whole medication and alcohol thing is a bit, it doesn't really work out. It's not so good for my body. So I probably about 3 years. So not straight away, because I felt pretty, after I got off the medication, it was pretty good. But now it's just one thing after the other, and the kids are getting older, and now this is just
more on your plate, and your parents.
Oh gosh, yeah.
Looking after them as well. Yep. So, in the past, you came off the medication? What were you doing at that stage to support yourself? Just give them a bit of an idea.
Well,
Was there anything that?
I was doing yoga for a bit.
Yeah.
Yeah. My friends got me into that but that wasn't very long. And yeah, I don't really know what else. Just kind of got into that because it's a bit therapeutic, I guess.
Mm-hmm. So it must be quite difficult. I guess like what we say in here is all confidential. I guess it's important for me to point this out, and anything that you say is just between us.
Yeah.
I need to just point out there's a couple of times when I would need to break that confidentiality if you or someone else close to you was at risk of being hurt or your life was at risk. I need to report that on to the proper authorities. Do you have any questions about confidentiality or when I would need to break that?
No.
Yeah. You say that you've been a bit depressed. Could you tell me a little bit more about that side of what's going on?
I just kind of feel a little bit down, and there's so much going on. It just feels like I kind of get lost in it all. But yeah.
And so I guess the advantage of having the alcohol is that it makes you feel a bit better about what's going on and gives you a way of coping. I guess the disadvantage of that is that you can't be on any medication or that it kind of masks the feelings that you were going through.
Because it's harder to get up in the morning if I feel sick and it's like kids going to school and so much to do in the morning as well. So much to do all the time.
Yeah.
And it's just, that doesn't really work out so well.
And, so how do you feel about trying to change your alcohol intake?
Well, I do want to change it, but because it's probably not the best thing to be doing. But I don't know. I just don't know how else I can cope.
Have you thought about talking to your GP again about going back onto medication, or is that something that you had thought about?
I haven't really thought about it. I mean, I guess I could go back and see if there's anything else I could try. No harm in it, I guess.
Yeah, and with the alcohol, have you made any steps towards actually reducing your alcohol intake or plans?
Well, we
been thinking about it, or
it's just a bit hard. Like I feel like I need something else to, help me cope before I try to. I mean, I tried to stop it a bit a while ago, probably last year, I think. But it's just a bit hard.
Yeah. Have you thought about a support group or counselling or other? Have you thought about other things that might help you? Have you tried anything like that in the past?
I've just been too busy.
Yeah. Do you have any other, you mentioned that you're looking after your parents and your children. What about your husband's parents? Are they around too?
Yeah, his mum's around.
Yeah.
Mum's around. She's retired, so she's probably got a bit more time. I mean, sometimes I'm really overwhelmed. I call her to look after the kind of not the young ones, just like the grandkids that are easier to look after because she's getting older. But not too often. I guess I could do that a bit more.
Just wondering if you'd be interested in attending a support group. Some really good support groups that deal with both alcohol dependency or a coping mechanism to get through your day, and give you some practical strategies as you, instead of turning to alcohol, you can have some other things in place.
Really good, yeah. Not too far away?
Yeah. Really, but yeah, time's fairly critical to you, and works in with the family so that they're looked after. You know, your husband or someone's around to look after the children, so you can go out. They're very short; they only last for an hour, and so that's kind of. And then that gives you a practical way of coping. The second idea, I guess, is to check in with your general practitioner. And just on that note, just wondering if I can just do a quick assessment about where you are in terms of your depression. In order to give you the best help today, I'm just wondering if you would be happy to answer a few questions just about where you're at. Or an alternative, I can just give you a form and you can just look at that and read that through.
I don't know.
Yeah, okay. I'll just ask you a few questions. Have you ever tried to hurt yourself in the past?
No.
Have you ever used alcohol or drugs to help you relax and calm yourself down or feel better?
Yes, alcohol, definitely.
Yeah. Have you thought about suicide, or have you had a suicide plan? In your lifetime, have you ever made a suicide attempt?
No.
So you're at a very low risk, which is important, and that's really good. You know, it's normal to feel overwhelmed with your husband not having employment. That puts a lot of pressure on you and the
especially money strains. I think. Just like this, worry, constant worry that we won't be able to make ends meet.
I was going to ask you about that. Have you got enough food in the house?
Yeah, I'm pretty good with the whole making dinner. That's always something there. The kids' lunches, sometimes there's just too much going on. I have to give them money for the canteen, which I don't really like doing because it's not as stable for them. But I think the main thing is like breakfast. The kids sometimes just don't. It's too chaotic. They don't want to eat. They're not getting dressed. They're not getting ready. It just ends up they're going to be late, or they're going to have breakfast, and it's a bit hard.
But the mornings sound quite difficult.
Yeah, because everyone's in the house.
Yeah,
they all leave around the same time, and it's just because they come home at different times. Sometimes the 17-year-old stays out at friends, so it's not always home for dinner. So it's like sometimes. Well, he used to work late. My husband used to work late, so he might not be home for dinner, but now he will be around a lot more. And
is the mornings more difficult with when you're actually consuming drinks at night? And
sometimes they're a bit rough.
Yeah.
Especially on the Monday mornings, and because it's just off the weekend, it's just like everyone has to.
So you're recognizing that the alcohol might not be the best.
Yeah, it's not so good.
There's a few things that you've mentioned. You've had a history of bipolar, currently feeling quite anxious, depressed, and worried about how you're going to cope financially. Go back and check in with your GP about medications and get on board your mother-in-law to help you a bit more, give you a bit more support in the house, to look at some practical strategies to help you with the drinking. Can you think of a strategy that could help you to minimise your drinking?
Maybe having like a non-alcoholic drink just around, like something It's got a bit of flavour to it.
That's a great strategy. Yep.
Yeah.
Yeah, that's really good. The aim, I think, is to get down to 1 drink a night.
Mm-hmm.
The group can give you some extra support to deal with bipolar condition. The group's based on behavioural things, learning how to think differently about problems that you have.
Mm-hmm.
It's very practical. It's very life-based and skill-based. The groups are very small, 8 to 10 people in a group.
No, it sounds good. That does sound good. As long as it's, at a time where I can make it.
Yeah, if you can't make that one, there are other programs. Right. Is there any other questions that you have or concerns that you have today?
Can you give me the details and
For sure. We can figure out a time and date and get back to your mother-in-law and find out dates and times that suit her, and we can look at those programs.
Sounds good.
That's great.
Thanks.
Okay, no problems.